why is that at the beginning there would be a different pattern of care, and how and when and why does that change as time goes on?
I always explain this to patients as it starts with patterns. So our lives are patterns, whether it's a pattern that started at 8 years old for you getting migraines because of your stress, and then you kind of layer on those patterns as you age and grow. This is why babies are so fun and are incredible to take care of, because they don't have very many patterns yet, right? They have patterns from the womb, patterns from birth. That's pretty much it at that point in a very young child's life. But as we grow and age, these patterns just get added and added and added on, kind of like layers of an onion. And what we're looking to do as a nervous system focused chiropractor is to start peeling back those pattern layers, teaching the body a new pattern and giving it the opportunity to catch on to that pattern and then do it for itself. So when I'm looking at a frequency plan for a patient, it starts with, well, how long has this pattern been going on? How deep-seated is this pattern? And then I always tell patients the goal is to get ahead of the regression. So usually what happens is you'll start coming in. You're going to feel great the day after your adjustment. You might feel great the next day after that. Every single person is different on how they hold an adjustment or how they accept that new pattern into their body. And then usually at some point, whether it's 3 days after an adjustment, 5 days after an adjustment, for some people 2 weeks after an adjustment, you're going to start to feel some regression towards the pattern that your body's been holding your entire life. And when we have patterns that we've been holding our entire lives, those are hard to change, right? So I always ask my patients, especially when they first start, be aware of what you notice. So tomorrow, if you feel wonderful, perfect, note that. 3 days later, if you still feel great, note that. When you notice that, you start maybe slightly, and this is normal, I always tell them, and this is normal, that things are going to start regressing a little bit at some point after an adjustment. Take note of how long that takes. And we usually give patients somewhere between 4 days and a week between their first and second adjustment for this reason, because I don't need to go and put new input into the body if it's doing what it needs to do with that information. So I actually want to see where that regression point is so that we know how to, make an appropriate care plan for them.